I thought that Operation Smile was all about cleft lip and palate. It's so much more than that. It is about educating future surgeons across the world to be safe and effective.
It's developed into the surgical rotation model, and we've been able to now have actual general surgery residents rotate with us and become part of their training as general surgery residents.
This is important for two main reasons. First of all, providing care for the population, and secondly for teaching and training of the Rwandan anaesthetic residents, and then obviously from the surgical side, the surgical residents. Also, I've noticed on this mission we've had quite a lot of local nurses as well, so they're getting additional teaching and training as well.
If I compare it to the surgical education in my country, it's very similar, but obviously on a much shorter term basis.
Generally, other opportunities that are available for residents are usually located abroad in other countries or other continents. But this program is different because it is in Rwanda with our own patients, and it helps us improve the health of local patients in Rwanda.
Here we get opportunity to see cases that we don't see normally in our residency. It's an opportunity to learn from other plastic surgeons.
No es solo dar cuidados sanitarios, sino que además es formar a los profesionales sanitarios locales para que ellos tengan la capacidad en el futuro poder continuar dando ellos mismos el servicio, esos cuidados a las comunidades locales.
In Rwanda, we have 11 million people with only 2 plastic surgeons. That is an overwhelming number or need for surgery.
Waiting list for one of the surgeons 6 months ago, that his waiting list was 4 years.
Their confidence increases over the course of the week, but also we try and focus a lot on some of the non-technical aspects of being an anaesthetist. For example, leadership skills, team working, decision-making skills. They're often technically very, very good, so it's about taking them to the next level so they're able to become team leaders and decision makers.
What I've seen happen is the residents that actually have graduated from this program are out now in district hospitals doing plastic surgery procedures.
It will change the whole country, it will change the life of people.
Es fantástica la energía que se respira y el positivismo, y es magnífico ver la colaboración y la cooperación que hay entre todos. Una experiencia inolvidable para mí.
To see Stryker's products actually be used in the Rwanda surgical training program was actually awesome. I got to see firsthand how we are making healthcare better.
Being able to do the work we do requires good tools to be safe, and it's great for residents to be able to see some of the tools that we use. The photon blade was really helpful in this situation because it has a light. Our lighting is poor here. The power goes on and off, so having that light in the wound was great to have cautery and lighted ability for that.
The majority of the population here doesn't have access to safe and effective healthcare. So I think that these surgeries mean the world to the patients, because to them, they may have traveled very far to get here or use their last money to travel here. So I think it's just so important that we're out here supporting this program. And I think that for the patient, it changes the trajectory of their life.
You see how it's transforming their lives when you see a patient who come with a non-functional hand because of contractures from burns. We asked the mother, the child is 5 years old, did you take her to school? She said no. Everyone is coming to see her fingers, how bad they are. She can't go to school, she can't write, she can't do anything. So this mission is life transforming for the community, for Rwanda in general, for this child who are our future leaders, future doctors.
Without health, we are usually miserable. So with a good health, we can be productive to our country, and it helps me to be part of that challenge of improving the future of our country by giving good health to our population.
There was no plastic surgeons when we first came to Rwanda. Now there are 2. We now generate an interest amongst general surgery residents to train in plastic surgery, and the future is actually to build a plastic surgery program here so that eventually we're no longer needed in Rwanda.
Throughout the past week, I've seen many commonalities between Operation Smile, the Rwanda training program, and Stryker, because we really do both have this shared vision of making healthcare better. I feel proud that our dollars are going towards a program that changes patients' lives, as well as people in the community who are trying to become medical and healthcare professionals. It's great to see that they're having an opportunity to actually change the future of the country.